Hello, I'm Dallas Pounds and I'm Director of Services for Lymphoma Action.
Hello, I'm Dr. Wendy Osborne and I'm a consultant haematologist in Newcastle.
We're here today to talk about the importance of shared decision making in DLBCL treatment and care decisions. So can you start by telling us a little bit about what shared decision making is and why it's so important?
So it's essentially making sure that our patients are involved in their treatment decisions. And often for our patients with lymphoma, we do have many treatment options and we need to make sure that we discuss all of them with our patients and what they involve, what the side effects are, what the hope of response rates are, so that our patients can make sure that their opinion matters in terms of selecting the treatment that best suits them. Because different patients have different priorities as to what matters to them in terms of their care decisions.
Absolutely. And when do you think that people should start to have those conversations with you to get involved in their care?
I think right from the start. So I think right that very first appointment, obviously the first appointment is usually us telling them information about the diagnosis and the treatment options. But initially, any questions, ask them straight away. When coming back to clinic, writing down lists of questions is important. Often bringing someone with you is helpful, whether it's a friend or a family member. Making sure that you've got access to the information, whether that's websites about lymphoma or booklets. And most of our patients should have access to clinical nurse specialists who are a fount of information about lymphoma and are usually available at the end of a telephone if another question comes up. So it's really important that our patients feel empowered, that they have the information that they require to allow them to be involved in that decision that's going to be the right treatment option for them.
Yeah. But there are some patients, Wendy, who don't want to be involved that much in their decision making, isn't there? That actually doctor knows best and I will do what the doctor is recommending to me. So how do you encourage them to perhaps be more involved if possible?
Yeah, so I think it's a balance. I think what I don't want to do is to add more stress to the patients for them feeling that they have to make that decision. But also, I think it's important that by them being involved, it helps the healthcare professionals understand what is important to them. So even if they don't want to make the final decision, but they can say to us, actually it's important that I'm not in hospital for weeks, I prefer outpatient treatment, or it's important to me that I avoid this side effect, so we can listen to what's important to them. And then that should allow us to hopefully be making the decision that's going to best suit them.
When people come to see you to be involved in the decisions about their treatment and care, what sort of things should they be thinking about? What sort of goals should they be considering?
Yeah, so I think that this is important because it's very different for different patients. So I'm always very interested in the effectiveness of the treatment. So I will be explaining to them the chances that we should get a complete remission, how long we should be expecting that remission to last. So effectiveness of treatment is a really important goal. The other things that are very important for patients to consider is frequency of visits to hospital, whether they need to stay in hospital. So I have some patients who might choose to not come to a specialised hospital because they'll be away from home for a month or be in hospital for a month. So for some of our higher dose treatments, that's what's required. So numbers of visits to hospital, whether there's side effects, these are all things that are important for patients to consider. So as well as just focusing on effectiveness, I think that patients also need to understand duration of treatment, visits to hospital, side effects, whether there are implications on whether they can drive, for example. These are all things to consider. So the goals of treatment that, as a lymphoma doctor, I very much focus on effectiveness might not be the priority for all of our patients. So they just need to have a think about what's important to them and then have time to consider all of these different effects within each treatment option.
Absolutely. And you said earlier about making some lists and maybe bringing somebody with you to the consultation, to have the conversation with the doctor. Have you got any other tips for people about how they might prepare and get the most out of that consultation?
Yeah, I think making lists is a good idea. I think for some of my patients, they prefer their friend or their partner to ask all of the questions, and that's fine too. So I have some that will sit there quietly, but I know that they've been involved in that list of questions, and that's really helpful. I've got some of my patients that prefer to ask the specialist nurse lots of questions because they have a good relationship with them and they see them more often, and that's fine too. So I think that just if in doubt, ask. There's so much information that it can be overwhelming. Make sure that you know who's available to contact.
So I think our message is that you can be involved in your decision making about your treatment and your care, and that it's okay to ask questions.
Yeah, I completely agree.
Fabulous. Thanks, Wendy.
Thank you.